Hello, everybody, and welcome to our Expert Perspective modules on curriculum development. This mini-series was created to give you advice and guidance on how to create effective and impactful curricula. Today, we will be featuring perspective from WHO's Dr. Dongbo Fu. Dongbo Fu is the Technical Officer for Tobacco Cessation in the Department for Prevention of Non-Communicable Diseases at the World Health Organization. The focus of his work is on providing technical support and expertise to WHO member states to strengthen health systems for treating tobacco dependence by applying and using WHO's policy recommendations through training, workshops, and development and dissemination of WHO technical tools. He studied medicine and received his MD from Jiangxing Medical College in China. He holds a PhD in preventive medicine and a master's in public health, both from the School of Public Health at Fudan University, formerly known as Shanghai Medical University. And now, without further ado, I'm going to turn this over to Dr. Fu.
Okay, thank you, May, for a nice introduction. Good afternoon, everyone. It's my pleasure to join this webinar as a presenter. So I'm going to use about 10 minutes to describe the development of WHO training package entitled Strengthening Health System for Treating Tobacco Dependence in Primary Care. So I mainly like to describe how the package was developed and what steps were taken to develop this training package, and also the information about its current use and the future applications. So first slide, please. The first, I'd like to give you a brief overview of the WHO training package. Actually, the purpose for us to develop each package actually is for us able to provide technical resources to assist countries to integrate brief tobacco intervention into primary care as part of their efforts to implement WHO FCC Article 14 guidelines. So we developed this package entitled Strengthening Health System for Treating Tobacco Dependence in Primary Care. If you can look at the slides, actually you can see it's a comprehensive package which was developed based on the understanding that the whole health care system needs to function well, and all health system actors should improve their skills and also play a better role in order to improve the integrated delivery of brief tobacco interventions in primary care. So you can see this training package actually contains 3 different parts for training of policymakers, healthcare service managers, and primary care providers. So each part, you will see the table actually covers specific subjects or content for the corresponding target audience. For example, the part 1 was developed for training of policymakers. The content of this part focuses on how to develop and implement health system policy to improve the delivery of brief tobacco interventions, in primary care. And part 3 was developed for training primary care providers. And the content of this part actually about how to provide service, how to deliver brief tobacco interventions as part of their routine practice. So in order to meet the need for training the trainers, this package also includes a 4th part on applying adult education skills to training. So you can use this to train the future trainers. So this training package was developed by WHO Tobacco Free Initiative. It took us like around 3 years to develop, and of course there are a variety of individual experts like Eta Short and Ken Watson from US, and many WHO collaboration centers and other partners. They all involved in this process as contributors. I would like to take this advantage to thank all of them for their significant contribution. Now move to next slide, please. If you can see from this slide, WHO actually followed 6 steps to develop this training package. The first step is to conduct a needs analysis and a task analysis. the needs analysis is actually for us to examine the need for developing the training package, and to also for us to enable us to determine the goal of training, or we can say what kind of target performance the training must achieve, or what we can say what kind of desired changes the training must bring about, and also help us determine who are the target audience for this training. So the task analysis actually is for us to look at the job of each target audience, to see what are the key tasks or responsibilities the target audience need to fulfill. So and also we can understand through the task analysis, we can understand what are the skills needed by the target audience in order to fulfill their job responsibilities. So with all this information, actually we can specify what needs to be taught, or we can say what kind of content our training program needs to include in order to help the target audience improve their skills to better perform their job responsibilities. So with this information, we can move to step 2. So based on the information we gathered through task analysis, we can now define the training objectives and the content for each target audience. So you can see for us, we have like three major target audience in the health system. So we did this for each target audience. And then once we complete second step 2, so once we have the training objective has been set, and once we have the key content has been defined, so in step 3, actually it's for us to prepare or develop program agenda and lesson plans for this program. So actually in this step, actually for us to define, like in your training program, how many modules you are going to include in order to able to cover all the training objectives you have defined in the last step. And then for each module, like you need how much time for each module, how long you will need in order to complete the module, and what kind of structure you are going to use for the module. And once you have all the modules defined, so you need to develop lesson plan for each module. It means how you are going to organize the teaching activities for each module. So with this step complete, you now can move to actually step 4. It's really for you to actually write the training materials. So normally, which will consist of 2 parts. One for trainers or facilitators, we call like trainer's manual or facilitator guide, and one part for trainees, normally we call trainees workbook. So it's the same in our training package. We have each part we have 2 for one for trainers, one for trainees. Say the process of developing training materials is not actually complete yet. Normally, before the training material is able to finalized or printed, you will need to deliver the training, use these training materials as a pilot in order to test whether the trainer is able to perform the skills, or you need to evaluate the impact of training. So you will need step 5 and 6 in deliver the training and evaluation of the training. So we did exactly the same when we develop our training materials. So when we have the draft version, or we call interim version of the training package, we actually use them at several national and regional workshops before it was finally printed. And all the comments and suggestions provided by participants at these workshops have been used to refine and improve the training package. So you can see, just very quickly say, we actually followed 6 steps to develop our training package. Now, next slide, please. Now, I'd like to share with you the information about how the training package we have been used so far, and what are future applications. The training package has been disseminated to all the WHO member states since we have printed, and now it's available in 3 languages. That's in English, Spanish, and Chinese. The English version you can download from WHO website. Everything, including the training package and also the relevant PowerPoint slides. I think the Spanish version is available on the website of our regional office, the PAHO office, and the Chinese version is not yet posted on the website yet. And the training package, including the interim versions, had already been used for about 18 national or regional workshops in the last 4 years. So many have been used to promote the integration of brief tobacco innovation into the health programs, such as TB treated programs, such as the program dealing with NCD prevention and management in primary care. So this has been used in almost all of WHO's 6 regions. So you can see has been used worldwide. So in terms of future applications, WHO is planning to, we have a plan, is planning to continue using this training package to promote the integration of brief tobacco interventions into the TB treatment programs, the NCD interventions, and the program dealing with maternal, child, and adolescent problems in primary care. So that's all I'd like to share with you today, and thank you for your attention.
Great. Thank you so much, Dr. Fu. I have a couple questions for you. My first question is,
please.
What is the process to follow if a grantee wants to use HUE materials in their projects? Whom should they contact locally?
Okay. I would suggest things because I think that, as I mentioned, the materials, the training package has been disseminated to all WHO member states. So I strongly recommend you make a direct contact our colleagues at the WHO country office, or you can also contact the regional office. Or you, if you wish, you can contact us directly as well. But why I recommend or strongly suggest you contact the country office and or WHO regional office first, because each region, they may need like different language version. So some specific language version is only available in the regional office or country office. So I would recommend you contact our colleagues at the regional office or country office first.
Okay, great. And as you've used the materials in different countries and regions so far, how do you adapt them for different cultures beyond language translation?
I would say the materials actually, in terms of key like models, or if you look at key approaches or key methods contained in training package, it can be used in every country according to our experience. The key things we adapt, or I think we need to change when we go to a specific country, is the way how you're going to present it, or how you're going to use this to form their training program or training agenda. And for example, the materials, we can use all of them in general, but you need to change a little bit according to the culture. For example, one thing is very simple example is some case examples, like case studies, like role play activities. We use some name in our training package. Actually, it's not very like widely accepted, culturally accepted by the participants. So we will simply change the name. Like, for example, change the name from Mike into the name very popular in that country. And also, you need to think about each country. The content may have different, some like specific focus. Like when you go to some country, they may have some kind of specific misconceptions about tobacco use or the dangers of tobacco. So you need to adapt to that kind of specific situation.
Great. Thank you so much. All of that was very useful material. Thank you for your time today. And is there any last comments or suggestions that you would like to make?
I would say, to me, like there are many like training materials available for training healthcare providers, or for example, the third part of our training package. I would strongly recommend when they look at if they want to have some significant change in at the country level, they may also need to think about like what kind of role health service managers and policymakers need to play in order to have some kind of system level change to promote the integrated delivery of brief tobacco intervention in primary care. So that means not just the training healthcare providers, but also think about what kind of things we need to do in order to like get a supportive system for health providers to provide service, mainly through the changes or through the role played by the service managers and policymakers. This is exactly our comprehensive training package aims to. It's like not just look at just one service provider or one health system actors. You need to look at different players, different actors in order to promote the whole system change.
Okay, thank you so much.